Scope of practice, RN and LVN. Practice acts. Know the limits in your practice act. Job description. Understand what is in your job description. Nothing without orders. Licensed clinicians must have orders. Assessing beyond your scope of practice. Complete assessments within your scope.
Hi Mark, I'm Becky, I'm your LVN. I'm going to be changing your foot wound. How is it doing?
It hurts.
Is it hurting?
Yeah, it hurts.
Let me just put my stuff down.
And I don't think my pickup line is working either.
Okay, well I'm here for your foot, so I'll just go ahead and do your foot dressing. Looks pretty good.
I don't know, it hurts.
Yeah, well it looks pretty good. Looks like it's gotten better. Oh,
I
good.
think it's going to fall off.
No. I'm just here for your foot dressing here. So we'll go ahead and clean it up and just put a new bandage on it today, okay?
Okay.
All right. So everything else going okay?
Except for my pick line.
Oh, okay.
I don't know what's wrong with that.
Sounds good.
It doesn't,
right. Almost done
it looks
here.
a little squirrely to me.
Yeah, I know, that happens.
So,
Yeah. Yeah, I hear that a lot with those things,
are
you know.
sure
You gotta
that's
be
going to
careful.
stay on?
Yeah, it's fine.
Are you positive?
Yeah.
I don't know. It looks like it's going to fall off.
No, this is how we do it here. And I don't have time. I'm late for my next appointment, so I gotta hurry up and just finish this here. And it looks good. All right. So everything else is fine, right? No pain?
Well,
Perfect.
it still kind of hurts.
Oh, well, it's fine. That's
Are you sure?
sometimes that's just how it feels.
And the pickup line's not working.
Yeah.
So
Okay.
I don't know what's wrong with that.
Oh, yeah. Actually, looks a little
Uh-oh.
dirty there. Why don't I just grab a dressing and try and change it for you? Now, I'm not supposed to do this, but it looks really bad. We should probably get it done. But I would hate to have you get an infection or something.
Well, what about the infection on that?
No, we'll just change the dressing, you
you
know.
sure?
I'm just here for dressing changes. I'm not really supposed to be doing this, so
Alright.
I'll get somebody else out here when I'm done. We'll just go through it real fast.
Okay.
Real fast. Here we go.
Real fast.
Yeah. Well, because I'm late. I'm late for my next one. Oh, they give me so many. Oh, I'm sure that goes right there.
What about doing that over again?
No.
No?
No.
You sure?
I'm doing this
It
for you.
still
Otherwise,
kinda hurts.
otherwise I gotta go.
Oh, alright.
Okay. It doesn't hurt. It just feels that way at first, and then it just gets better.
I
It
think-
always gets like that after a dressing
I think
change.
it would fall off.
No. It won't fall off. It looks
In
good.
regards to scope of practice, Rebecca is an LVN.
Here we go. Don't touch it. Oh no.
You sure?
Yeah, I better call someone about this. This just doesn't look right. Oh, I'm kind of nervous here. I'll just call somebody because it looks like your line came out or something. I'm not sure what's going on here. Yeah, we'll just put that on there and we'll get someone else out here in a day or two and they'll make it it'll be fine. Okay.
Alright.
All right,
sure?
I gotta go.
My foot's not going to fall off.
No,
right?
it's fine.
Yeah. And this looks okay?
Yeah.
Okay.
Do you have any medication or anything to take for the pain?
I don't know. Do you have any medication? I think I have some medication
Okay.
somewhere.
All right, well, go ahead and take it. All righty. All right, we'll see you next time. Thanks so much. Here, let me put that over here with all the other stuff.
I can
All
use
right.
that, right? Thanks.
Rebecca, where is your computer?
Oh, it's in the car. It doesn't work today. I'm gonna get it fixed. Doesn't work.
I'm going to IT guys and get it fixed.
It's good to get it fixed. So what just occurred? Was the clinician performing within scope of practice? Were there orders for all treatments? Do you see what happened when the PRN order was not called to the service coordinator? Comprehensive assessment must be completed each visit, where both fee assessed. Med reconciliation, was med reconciliation completed? Discuss the incident with the manager, submit a QI.
I was calling because my arm is really hurting. They put the pickup line in and it doesn't seem to be working. And then also my foot, the bandage on my foot, I don't know what they did, but it looks like my foot's going to fall off.
Okay, do you know the name of the nurse that took care of you?
seem to be working. And I don't know the name of the nurse, but I think you guys need to have someone come out here and fix this.
Okay, and what exactly did the nurse do to you? What was it that
she
was
put
doing?
a PICC line in me, and then she also wrapped my foot up in a bandage because my foot was hurting.
Okay.
So, but I don't know. This PICC line seems to be hurting even worse.
Okay, we definitely will send someone out. I'm not sure what time, but we'll send a nurse out to see you.
Ding, ding, ding.
Mr.
Hello?
Mark, hi. This is the service coordinator from St. Joseph Home Health.
Oh, when are you guys coming?
Well, I do have a nurse that's on her way, and her name is Gina,
Okay.
and she'll be there shortly, and she's going to take care of you.
Okay.
Come in.
Hi, Mark Blomberg.
Yes.
Hi, I'm Gina, your nurse. I understand you called. You have some
Yes.
problems
I
today?
have some issues, more than one. My pickup line or whatever this is doesn't seem to be working. And,
Yeah, that's not looking good. Let me,
and my foot has some blood and some black hairy stuff coming out of it.
oh
I
yeah,
don't know what
that's
that
not
is.
looking good. Let me
No.
just get this set up here. Just a second.
You have a computer. How nice.
Yeah,
Great. You guys use that for all of your medical
yeah,
stuff?
all of our charting.
Oh.
We get it from in here.
Which of the
all
guys
right.
who set those up are great.
Yeah,
No.
they are. They're wonderful.
So,
All right, what's your birthday?
7/11/67,
Okay.
I think. Yes.
I think I'll start with that PICC line. Let me check my orders here. All right, that's not looking too good.
Oh, the PICC line? I
Yeah.
think it's missing some parts or something. That's good. Got your hands all nice and sterile. That'll be perfect.
Yeah.
So is this supposed to be like that?
No, it's not.
Okay.
This has really come out.
Yeah, it's not looking too good. I'm not really sure what its deal is.
Well, it's not even in your arm anymore.
Well, there's your problem.
Yeah. Okay, I'm just gonna have to cover this up. Hold on, don't touch it.
Oh.
Keep your head turned that way.
Oh, it's
There
turning
you
it
go.
down. Okay.
Yeah, I'm just gonna have to go ahead and take that off and call your doctor right now, because that's not
Okay.
in your arm anymore there. And who's your doctor?
Dr. I don't remember his name. Dr. Schohausen? I don't know.
Okay, I'll check. So were you using this arm for something? Were you moving it around a
sometimes
lot?
I play tennis with it. You know, different things. Feed the dog.
Well, you're really not supposed to be using that arm
Sometimes I pet the dog.
too much.
So, I'm not supposed to be using this arm?
Well, not to play tennis.
Oh,
No.
alright.
So we're just going to leave this on here for a second, and I'm going to call your doctor
Oh,
and let
okay.
him know that this fell out.
Okay,
Because we might have to start a line in your arm if we
Oh.
need to do your IV.
okay.
Okay, so let me just give your doctor a call.
Alrighty.
And then we'll look at that
Figure
foot.
it out.
Yeah.
Okay.
Put your foot up.
It was hurting it for a while, and now it's starting to bleed, and
Okay, so let me go ahead and take that off.
I don't think it's wrapped very good.
Yeah, it looks kind of loose.
Watch the toes. It's hurting a lot. And it's, bleeding a lot. Mostly hurting and bleeding.
Did you take anything for pain today?
No, I don't think I did.
Do you have pain medicine available?
I think maybe my brother has some pain medicine.
Okay, we'll check and see what you can take for that. Okay, so let me look at the orders here and see what we're doing.
Trusty computer there, huh?
Yeah, it tells us everything we're supposed to do here.
It's pretty great.
Alrighty, well we'll get that cleaned up for you.
Okay.
Maybe it was just a little too loose. Okay, so I'm going to go ahead and leave that. I'm going to call my manager right now,
Okay.
and we're going to have to work on getting orders.
Hi, this is Becky.
Hi Becky, this is Gina. I'm out with Mark Willenberg, and I came out to do a PRN visit, and his PICC line is completely out, so I just went ahead and took it off and covered it with the gauze. And then his foot dressing, his foot is red and inflamed. It might have been wrapped a little tight, so I am having trouble getting a hold of the doctor. Could you possibly, if we need to do the IV, get us orders for a peripheral IV start tonight? And then the foot has a lot of extra drainage, some slough. We were just wrapping with the dry clean dressing before, so we'll also need to possibly cleanse with wound cleanser and then apply maybe some Silvasorb gel and Vaseline gauze, dry clean dressing, and wrap.
Okay.
Okay?
All right, I'll call the doctor on call and I'll call you back once I get a hold of him.
Thank you.
All right, bye-bye.
Okay, bye-bye.
Hey, Mark.
It's my brother.
How you doing? You feeling better today?
Hello.
Good, good. I got some new medications for you. Went
Oh.
and picked up that prescription.
So are these brand new from the doctors, or what are these?
Yes, these are brand new. He had went and seen the doctor earlier in the week, and
Oh, okay.
just went and had the opportunity to pick these up. You know, I'm really busy, and he can't go anywhere. So I'm gonna go put these with the rest of your medications that we have upstairs.
Okay. Yeah, you could just put them on the bedside.
Which medications, are there anything new upstairs?
There's a bunch of them.
Yeah, we got all
Could
kinds
you
of stuff.
bring those down, and that way I could just look through to make sure we have everything?
Sure,
and-
I'll give you
Okay.
these, and I'll go grab those. Too.
Okay, that would be great. So these are brand new from your doctors?
Those are brand new. We got a bunch more. back
Okay,
there,
well, we'll
yeah.
see what else
Horse
he
tranquilizers,
brings down to
All right,
us.
nurse, here you go. Here's the rest of the meds. We have these upstairs. That's kind
Okay.
of where I'm at. That way I remember to give
And
it to
these
him.
are, you're taking all of these?
Yeah, let me take a look at those. Take these a few
Don't let him
times
take
a
too
day.
many of those, you know, it makes him kind of dizzy. So.
Okay.
I like those.
Anything else that he takes as needed? Is there anything else?
No, it's just the new ones we got today and then what I keep by my bed so I remember to give it to him.
Yeah, just the legal ones.
Okay, and I was noticing you have a couple of half-used IV bags. What happened here?
Well, we use them a couple times a day. Sometimes,
Are you not finishing the entire IV?
sometimes we don't finish them and we just put in a new one.
Okay, well, we need to make sure that when you hang it, that you are finishing the entire IV. Let me check these.
Okay.
Make sure. Yeah, are there any more in the refrigerator?
Yeah, do you want to see what we have in the fridge?
Yeah,
That'd probably
that
be
would-
helpful, huh?
that would be
Okay.
great.
Sure.
Ring, ring, ring.
Excuse me. I think this is my manager calling back. Hello?
Hi, Gina. It's Becky. I got a hold of Dr. Sue on call for his regular physician. He said go ahead and put in a peripheral 22 gauge. Do you have that available to you?
Yes, I have one here.
Okay, and make sure he doesn't miss. And the wound care dressing with the self-absorbed gel and cleansing with wound care cleanser is just fine. He needs to call the office tomorrow and set up an appointment to see his regular physician.
Okay, sounds good. Thank you.
All right, bye-bye.
Okay, bye-bye.
So who's gonna write the order for that?
Oh, me.
Okay, so the manager that talked to the physician on call is gonna be writing the order.
Mm-hmm.
Okay,
Yeah, because I got it. It's my
Okay.
verbal.
perfect, okay.
Okay, great. Well, the doctor called back, and I will go ahead and start a peripheral line in your arm. You need to keep it clean and dry, and just kind of protect it. If you have any problems with it, you could call our office 24 hours a day. And then I'll start some new wound care today,
Okay.
and on your foot. And I finished putting all these in the computer. I noticed that you have the Ensure. Did your doctor say it was okay for you to take that?
Yes.
Okay, how many of those do you take a day?
Yeah, about 4.
4? Okay, and your doctor says that's okay?
Yeah, he says that's fine. Thank
Okay,
you.
great. And then I noticed you have this inhaler that's new. How often are you using that?
I use that probably about twice a day.
Perfect. Twice a day, once in the morning, once at night.
Mhm.
And are you familiar with how to use it?
No.
Okay, so you're going to give yourself a click,
Okay.
okay? And then you'll know because the number will go down.
Oh.
And then you're going to take a deep breath in,
Uh-huh.
okay? Hold
Okay.
your breath.
Got it?
Okay, and then when you're done with that, you're going to rinse your mouth out, okay? Because it kind of leaves a residue, and you want to rinse your
Okay.
mouth and spit,
Okay.
okay? Twice a day.
Sounds good.
Sounds good. Okay.
I'm not supposed to let anybody else use that either, right?
No, these are all just yours, so never share your medication.
You hear that, Gabe? Don't use my inhaler.
Will do.
That's good, we're done. So what did we see that Gina might have been able to do a bit better? Some hand washing, people are kind of saying she could have washed her hands more frequently, in and out of your bag, and at the end of the visit, which of course you weren't done yet, follows all the HWO hand guides. Mark, how did you feel as far as her keeping you informed of stuff?
I felt good. Oh, I thought she did a good job of
Okay.
informing me on everything.
Did you need to do a demo of that inhaler?
I truly don't even know how they work, so I was just like,
So a demo
so
would
I
have
thought
been
I'd
helpful.
ask.
A demo would have been helpful.
Well, I mean, she told me what to do with it.
Have them actually suck this?
Yeah.
Yeah,
Really?
yeah, but a patient,
Well, a
You could've.
patient, yeah,
Yeah.
but him,
No,
I'm
no,
not
no,
gonna,
but-
yeah.
Yeah.
Yeah, because he
So-
might have understood, he might have said well, yeah, I understand, but when you really put it to practice is
Right.
where
Yeah.
that demo comes back, you know.
Yeah, I mean, I may have done it if I was a real patient, but because of what we're doing here, I wasn't about to try it out.
I need my morning hit.
so actually what Gina and Gabe portrayed as medications upstairs was during a survey in 2010 that the patient did have extra meds upstairs. That's why Gina went to reconcile everything on her computer for us. Also, please always remember there could be infusion meds in the refrigerator that you must make certain the patient is taking as directed. So nice job on that, Gina, half full, et cetera, et cetera. Gabe, great, you took the meds, you explained they were a week late of getting there, et cetera. So I saw 3 QIs at least. Med mismanagement, especially the week late, the doctor would have to be informed of at some point, probably not 5:30 at night. You need to get a hold of the primary. Gina, I'm sure, would debrief, or Becky be asking her what happened to that dressing. Was it something Mark was doing? Because he implied he wasn't truly homebound out playing tennis, but maybe he was just practicing. He also, I heard him say he was playing with the dog a lot, and I don't think you heard that, Gina, for infection control. Yeah, it was like, uh-oh. And then, of course, the one that we're really trying to portray here is that the LVN has to stay within a scope of practice. The reason that we put this all together for scope of practice was that the surveyor looks at your scope of practice also as getting physician orders. So if somebody was doing something not only without an order, which Gina was excellent at saying, I've got to have an order, got to have an order, got to have an order. But if we do PRNs without an order, and then that can also show up in your scope of practice that you weren't following physician's orders. So there's 2 levels of that, which can get very serious with your license as Dina said in the narrative in the beginning, your scope of practice, all of that, and your licensure rights. So great job, everybody.
The other thing too is we have a patient that's getting wound care and also the PICC line, which is the infusion doctor. Did those orders for the wound come from the same doctor?
Right,
It's another thing to think about because a lot of times infection disease doctors don't give wound care orders. So.
right.
And whomever is getting the verbal order is actually writing the order. Whoever talks to the doctor writes the order because it's their verbal order going out.
So one of the things that we'll be doing a bit differently is that the on-call triage nurses after hours, especially the later into the evening it gets, will actually be double checking, is there a PRN along with the nurse that's going out, and if not, the on-call triage will probably try to contact the physician because she's stationary, the nurse out in the field may be driving, whatever. So we're tightening that up a bit more than we have before. It's a different change of how we're doing things.